بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. في الأول طبعا بنشكر الدكتور هشام على هذه الفكرة الرائعة اللي جمعت تقريبا معظم الأقسام في كلية طب بنها، ودي حاجة كويسة أوي 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 أوي، وإن شاء الله كلنا نحذو حذوه. هو راجل طبعا بقاله حوالي سنة دلوقتي شغال في زكاة العلم، ودي حاجة فعلا اسم على مسمى، حاجة جميلة. وانا شرفت طبعا ان انا شاركت معاهم قبل كده انا وبعض الزملاء من قسم الجراحه، والنهارده طبعا الموضوع بقى اوسع واوسع واصبح مؤتمر كبير على مدار 3 ايام. يشرفنا طبعا وجود الدكتوره عزه. اتكلمنا على موضوع مهم قوي، النون اكسيدنتال ولا نون تروماتيك تشايلد ابيوز، ودي حاجه طبعا من الحاجات المزعجه اللي دايما تيجي لنا الطوارئ ما نعرفش نتعامل معاها، ولازم يكون لها بروتوكول. فنتعشم ان شاء الله الدكتوره عزه تضع يدنا على هذه النقاط الغائبه عننا ان شاء الله. اتفضلي يا دكتوره عزه.
شكرا يا فندم، وانا سعيده جدا اني موجوده مع حضراتكم النهارده، وبشكر طبعا استاذنا الاستاذ دكتور هشام الشيخ على دعوته الكريمه، وبحيي طب بنها وقسم الاشعه في طب بنها على مجهودهم الكبير حضرتك، وبحيي كل الساده رؤساء الجلسه وكل السبيكرز النهارده. خليني انا بحاول ادخل بشير سكرين بس هوست ديسيبل بارتيسيبنت. ايوه انا دلوقتي بحاول اهو. حضرتك عامل لي ديسيبل برضه لسه ستيل عامل لي ديسيبل. ايوه تمام. انا كده فول سكرين. طلع بس الليزر بوينتر تحت اسمك. تمام. During the coming 20 minutes, I'm gonna talk about the imaging of pediatric non-accidental injury. During the talk, we will highlight different clinical presentations of child abuse and mechanism of trauma. Also, we'll describe the imaging features of inflicted skeletal, neurological, and visceral trauma patterns in cases of a non-accidental injury. The USA, in the year of 2019, there were more than 600,000 reported cases of child abuse. Of these, 4 to 5 children die every day from neglect. And the children who survived from abuse are about 9 times more likely to become involved in criminal activity. About 10% of the children less than 5 years who are brought to the emergency room with alleged accidents have actually suffered non-accidental trauma, and health professionals are mandated by law in the USA to report suspected abuse within 48 hours to Children's Protective Services. The first description of child physical abuse was by the French forensic physician Ambroise Tardieu in the 18th century. And the next mention in the medical literature was in 1946 by the American pediatric radiologist John Caffey. So it was the description of a radiologist. So radiologists are actually often the first to suspect accidental injuries when confronted with particular injury patterns, and in knowledge of these patterns is essential, number 1, to save a child from future neglect, and number 2, not to accuse an innocent parent or guardian. The mechanism of non-accidental injury was classically defined or known by the shaken infant syndrome, where brain is injured by acceleration-deceleration movement, chest is compressed by resulting in rib fractures, and the classic corner metaphyseal fractures of the bones. Actually, we have clinical presentations that are suspicious and raise the red flags for child abuse. When the injury is seen in a non-ambulatory, totally dependent child who cannot walk. Number 2, incompatibility between injury and history. 3, delay in seeking medical attention for multiple fractures with no history of osteogenesis imperfecta. 5, presence of retinal hemorrhage. 6, torn frenulum. 7, history of household falls resulting in fracture. Despite falls being common, fractures are uncommon. The patterns of non-accidental injuries I will present today will be skeletal, neurological, orbital, spinal, as well as visceral injuries. Starting with the skeletal injuries, our first case is a young child X-ray at clinical suspicion of rickets. The history is very important. History should be combined with a radiological presentation. So give attention to the history. What we see here is a corner metaphyseal fracture. This is typical. When you see that in a clinical setting of no history of trauma in a child, this will be a high suspicion, or there will be a high suspicion of non-accidental trauma. Why? Because metaphyseal corner fracture is highly specific for non-accidental trauma. The second case is a 2-month female presenting with unexplained crying and irritability. Again, no history of trauma, ambulatory child. So what you see here, radiolucent metaphysis, and in the oblique views, you see the typical corner metaphyseal fractures. The third case, the 6 weeks female, mother noticed her to be irritable after falling from bed. Minor history of trauma, minor trauma, but we found this spiral femoral fracture. Diphyseal fractures, unlike metaphyseal fractures, are non-specific, and they do occur in both accidental and non-accidental injury. Spiral fractures are a result of twisting forces, which are uncommon in accidents in young children, but more common in adults. So, and a simple fall from bed will never produce such a spiral fracture in an infant. So, there was a high suspicion of child abuse. Bone isotope scan was ordered. As you can see here, the posterior rib fractures. But where is the right femoral fracture? We cannot see it on the bone isotope scan. Here's the explanation, because of the displacement of the femoral fracture, which may have prevented osteoblastic activity. So be careful when reading the bone isotope scan. It should be put together with the X-ray. The fourth case is the 4-month female, no history of significant trauma, and we found multiple fractures at the right humerus, at the tibia in the mid shaft, and in the lower shaft of the left tibia, multiple fractures with no history of trauma. So a child with multiple fractures, with no history of trauma, or no family history of osteogenesis imperfecta, raises a possibility of non-accidental injuries. Summarize the fractures that are highly specific for child abuse: the bucket handle or corner fractures, ribs, especially posterior, acromion, spinous process, sternum, and occipital impression fractures, as I will show you later. The radiographic studies in suspected cases of skeletal injuries should include skeletal survey, and babygram is not an acceptable substitute. Bone scans are essential to also detect occult fractures, and of course these are the views you should order for skeletal survey. Let's move to the neurological injuries, and it's called nowadays the abusive head trauma, and occurs in more than 30% of all cases of non-accidental injuries. It's a big issue, and is the leading cause of morbidity and mortality. The imaging modalities should include skull X-ray, CT, and the 3D volume rendering of the skull is very important in that circumstance, and MRI in certain cases. Let's start with some cases. This is a 3 years female, mother noticed swelling in scalp, no history of trauma. With the 3D rendered images, you see diastasis of the right parietal fracture, diastasis of the sagittal suture, and a fracture here in the left occipital bone, which is traversing the suture. So fractures that suggest child abuse in the skull include multiple eggshell fractures, occipital impression fractures, and or fractures crossing sutures. This is a 1-month-old boy with left parietal fracture here, but look at the what's called the accessory parietal sutures. Don't mistake that with fracture. Here comes the value of the 3D CT volume rendered images that help differentiate between fractures and accessory sutures commonly seen at the infant stage. Next case is a 3-month female, unconscious infant, and the child stopped breathing at home. With the CT, okay, no history of trauma, but we found this marked edema in the left cerebral hemisphere together with the right frontal lobe. This is a subdural hematoma. This is the fracture in the posterior parietal bone surrounded with this scalp edema. In the MRI, we confirmed all the features with the subdural hematoma seen here. But look at this finding here. What's this? This transfalcine herniation of left cerebral hemisphere coming to the wall. And look at the tentorium on the right side here, compare it to a defect here in the tentorium on the left side with the brain seen coming through a defect. This is another herniation. So brain herniation is very important. Don't miss them, and they indicate poor prognosis. And actually, or unfortunately, the baby died. Next case is a 5-month-old adopted boy. Admitted to the hospital in a bad general condition. Look at the CT, you see bilateral subdural hematomas, could be hygromas. This is a fracture here in the posterior parietal bone. To the MRI, we see very important sign. Look at the subdural hematoma on the right side, compare it to that one on the left side. They have different intensities indicating different ages. So subdural hematomas with different ages are highly suggestive of child abuse. History supported the diagnosis, and this should not be mistaken with subdural hygromas. When you can see a traversing vein here, this is a traversing or bridging vein which is seen coming through the hygroma. That case, the traversing vein is thrombosed. Look at the signal, and rupture appears irregular here, causing bilateral subdural hematomas. Next case is a 10 weeks boy with seizures and bilateral femoral fractures. In the diffusion weighted images, we see here areas of restricted diffusion at the splenium of corpus callosum, a typical location for shear injury. This baby was aggressively shaken, and we had these splenic hematoma. It's called diffuse axonal or shear injury. The same case with the gradient echo images, very important. In these cases, we found these foci of susceptibility, okay, and blooming. Located at the white-gray matter interfaces in parieto-occipital lobes, indicative of hemorrhagic diffuse axonal injury. So when you see that, you should suspect shear trauma or shaken baby. This is a 3-month boy with seizures and multiple body injuries. In the diffusion weighted images, we see diffuse hyperintensity or restricted diffusion of the whole cortex and subcortex of the supratentorial brain, sparing the deep gray nuclei typical for hypoxic ischemic injuries. It's reported that hypoxic ischemic injury imaging abnormalities are up to 4 times more common in abusive head trauma than in accidental trauma. So when you see them, you should also raise a red flag here for suspicious child abuse. Next case, in the T2, this is a 12-week boy with multiple injuries, no clear history of trauma. We see T2 hyperintensity on the right side, hemorrhage and CSF intensity on the left side, and the laceration here in the parasagittal parietal lobe. With the diffusion weighted images, we found also the bilateral posterior hypoxic ischemic injuries appearing as restricted diffusion in the cortex and subcortex, and these are called the laceration clefts. So parenchymal lacerations in abusive head trauma known as contusional tears, contusional clefts, or gliding contusions. Okay, they result from shearing of the white matter and sparing of the gray matter, and specific for abusive head trauma, and found in 13% of patients with abusive trauma, as opposed to no patients in accidental injuries. So when you see these contusional clefts, there is a red flag here. It's unique entity seen in infants less than 5 months of age. Why? Here is the cause, because shear forces differentially injure the gelatinous unmyelinated white matter. Let's move to the spinal trauma. This is an ugly sacral fracture dislocation in a 2-month-old girl, and the cause of trauma was slamming of the baby in a sitting position. Okay, this is a vertebral body compression fracture. Just taken baby. البيبي ترجرج جامد, it has جامد, and we found this compression fracture. This is one of the important findings and could be subtle or could be missed. It's called the ligamentous complex injury, and in that coronal view of the spine, cervical spine, we see right atlanto-occipital and right atlanto-axial joint fluid indicative of a capsular injury, and here you see edema in the suboccipital soft tissues and posterior ligaments, suggesting a posterior ligamentous injury. Again, the cause of trauma was aggressive shaking of the baby. This is a subtle subdural hematoma. It's confirmed with the axial view here when you see this slit-like crescentic shaped lesion. In epidural hematoma, we see this elliptical epidural hematoma secondary to this laminal fracture. This was child abuse. Also, this is an interesting case. It's called the retroclival subdural hematoma. Look at the very subtle linear blood collection here in the retroclival region. But when you see this, search for that, because they usually are associated with each other, which is an occipital subdural hematoma, okay, with the same blood intensity in all sequences. Orbital trauma, this is a 2-year-old. When you see right retinal vitreous hemorrhage, and the cause of trauma was shaking of the baby, and the presence of vitreous hematoma is very dangerous and having bad prognosis because it indicates compromise of the vision of the baby. In retinal hemorrhage, focal hypointensities seen posteriorly around the optic discs. The visceral trauma, of course, duodenal hematoma, one of the specific signs indicating the child abuse. When you see filling defect in the duodenum, as in here, could be confirmed with the CT, you will find hematoma. This was actually a 6-year-old boy who was beaten by a caretaker. This is a bowel injury and perforation in an 18-month-old boy who was beaten by the caretaker, free intraperitoneal fluid, air, and thickened bowel loop. Pancreatic laceration in a 2-year-old girl. This is hepatic laceration in a 14-month-old boy. Estimate that 2 to 10% of all abdominal injuries results from child physical abuse. The mean age of these children is about 4 years. Mortality rate is more than 50% due to patients and doctors' delay. These children presented with peritonitis and sepsis, and this is the main reason of death. And of course, there is incompatibility between the history and the clinical situation. Interestingly, the most common non-accidental abdominal injuries are visceral perforation or hematoma, liver and pancreatic laceration, or adrenal bleeding. The most common abdominal accidental injuries, which are splenic and renal laceration, are unusual in the abused children. Be careful not to accuse an innocent person. أنا دايما أقول للطلبة عندي في المحاضرات، أنا بعد ما بدي المحاضرة دي هتشخصوا كل العيال اللي هيجوا لكم child abuse وهتعملوا مشاكل لأهاليهم. Please be careful. Okay, so you should be acquainted with the differential diagnosis. Number 1 is accidental trauma, and this is a neonate. Look at this multiple rib fractures, but when taking the history of the baby, we found that he had a very high birth weight, 5,500 grams, a big baby, and this was the main reason of these fractures. The second is the osteogenesis imperfecta with multiple rib fractures. Look at the abnormal bones. Menkes disease is a rare inborn error of metabolism with small metaphyseal hooks that might be mistaken for metaphyseal fractures. Also, same applies for metaphyseal dysplasia. Look at the abnormal metaphysis here. The Café disease also is unknown with unknown etiology with extreme periosteal reactions. Bilateral adenal hemorrhages, but the main reason was the baby had bleeding disorders. And to summarize, we should increase our awareness of child physical abuse, and the detection rate of non-accidental injuries depends on number one, discrepancy between history and type of degree of injury in non-ambulatory children, also the presence of corner metaphyseal fractures, posterior rib fractures, neurological and visceral patterns of injuries, which are specific for non-accidental injury. Again, be careful not to use an innocent parent. الحقيقه دي استادي كويسه قوي معموله في مصر، انا لقيتها منشوره على الانترنت، معموله ما بين اليونيسف والمجلس القومي للامومه والطفوله، اسمها Violence Against Children in Egypt، published 2015. بتتكلم على quantitative survey and qualitative study in Cairo, Alexandria and Asyut. الفايندنجز الحقيقه astonishing findings، لو تحبوا حضراتكم تطلعوا عليها موجوده منشوره على الانترنت. زي ما دايما بقول the physical injury might hear but the psychological insult will never heal and the child will never ever forget the abuse. ده الرقم ده هو التليفون، اسمه number to remember 16000. لو حسيت انه البيبي اللي قدامك دون بيتعرض لفايلنس حرام، سجل الراديولوجيكال فايندز اللي موجوده، كلم البيدياتريشن او الدكتور الشغال في الامرجنسي روم. حرام تسيب البيبي ده يروح في مكان يتعذب فيه تاني. Thank you.